Hello, everybody. This is our case study on hypothyroidism. My name is Araceli Gonzalez.
And my name is Jessica Aparicio.
So our patient is Maria Enriqueta Salas. She is a 66-year-old Mexican-American woman that was diagnosed with hypothyroidism in 2003. It was in 2003 where Maria noticed a negative change in her health. She began to feel weak, tired, nauseous, cold, and was gaining weight. She took notice that her menstrual cycles were off as well, and as for her mental health, she began to feel very depressed. So she followed up with her primary care physician, and after diagnostic testing, she was diagnosed with hypothyroidism.
During Maria's physical exam, they checked standard things such as her weight, blood pressure, and height. The doctor then asked Maria about her family history and her current symptom. As Maria began to list her current symptoms, her doctor began to take a look at her throat and her skin. She then ordered labs to rule out any medical conditions that would be triggering these symptoms. The two blood tests that her doctor ordered were TSH, which stands for thyroid stimulating hormone. This measures how much the thyroid hormone thyroxine is in our bodies. The second test is T4, which is the protein called thyroxine binding globulin.
So Maria's recent lab showed her TSH blood work isn't within normal range, but her primary care physician still has her taking levothyroxine because it is regulating her levels. The other blood work she got done, the only thing that was a concern was the anion. So the treatments that were given to Ms. Salas were information about the thyroid and how it regulates the functions in our body. She was prescribed the levothyroxine, and she was told to take 100 mcg tablet in the morning before she had a meal. She was also advised to take iron, calcium, or multivitamins at least 4 hours after taking levothyroxine. In addition to the medicine, she needed to do daily exercise for 30 minutes to support her physical and mental health, and she has to get follow-up testing every 6 months.
So now we're going to talk about the thyroid gland and where it is located, what it does, and how it affects Mrs. Salas. So our thyroid gland is located below the larynx, and the two lobes are on either side of the trachea and are connected by a medial mass of the thyroid tissue called isthmus. So on a microscopic level, the thyroid gland consists of numerous hollow sacs called thyroid follicles. These follicles are lined with a simple cuboidal epithelium, which are composed of follicular cells that are produced by the thyroid hormone thyroxine. In the interior of the follicles contain colloid, which is a protein-rich fluid. In addition to the follicular cells that secrete thyroxine, the thyroid also contains parafollicular cells that secrete a hormone known as calcitonin.
So this is the production and storage of the thyroid hormone. The thyroid follicles actively accumulate iodide from the blood and secrete it into the colloid. Once the iodide has entered the colloid, it is oxidized and attached to a specific amino acid within the polypeptide chain of protein called thyroglobulin. The attachment of one iodide to tyrosine produces MIT. The attachment of two iodines produces DIT. So within the colloid, enzymes modify the structure of MIT and DIT and couple them together. So when two DIT molecules are appropriately modified and coupled together, T4 is formed. And when one MIT and DIT form together, T3 is formed. So it is important to note that they are still bound to the thyroglobulin. So upon stimulation by TSH, the cells of the follicle take up a small volume of colloid by pinocytosis, hydrolyze the T3 and T4 from the thyroglobulin, and secrete the free hormones into the blood. So this diagram is basically going over what we just talked about in the last slide of how the iodine is actively accumulated and it's secreted into the colloid. The iodide is attached to tyrosines within the thyroglobulin molecule. One iodine produces MIT, two iodines produce DIT. The enzymes within the colloid attach and create T4 and T3, and then they are still attached to the thyroglobulin and they dissociate when the when the thyroid gland is stimulated by TSH.
Lack of adequate iodine in the diet reduces the negative feedback inhibition of TSH secretion, resulting in excessive secretion of TSH that stimulates the formation of an endemic goiter. So what is hypothyroidism? Hypothyroidism is when the thyroid gland is not producing enough of the hormone T4 thyroxine. What is the cause? So as I stated earlier, hypothyroidism can result from a thyroid gland defect or from insufficient TRH secretions from the hypothalamus. Insufficient TSH secretions from the interior pituitary or insufficient iodines in the diet.
So what is the thyroid responsible for? So the thyroid secretes thyroxine and T3, which are needed for proper growth and development, and which are primarily responsible for the basal metabolic rate. So these are some symptoms of hypothyroidism here. The symptoms that we've seen in Maria Salas's case are that she experienced sensitivity to cold, weight gain, muscle weakness, irregular menstrual cycles, and depression.
So in Maria's case, the organ systems that are affected that affect her are the digestive system, the reproductive system, but other organs can be affected, such as the cardiovascular system that helps regulate the amount of blood that pumps through the heart, and the nervous system that can cause symptoms including numbness, tingling, pain, and sensitive of burning in the body. And then finally, the hypothyroidism can cause depression, and hypothyroidism can cause anxiety.
So here are references, and thank you for listening to our case study on hypothyroidism.